Good evening, good afternoon, and good morning. This is the 2042nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. Amit Mittal. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. And we are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of the forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is Professor Dr. Amit Mittal. Sir has completed BHMS, MBA, PGDHM, PGDMLS, FMC, and is the founder, CEO of the Swastham, co-founder of CEO Global Institute of Cosmetology and Aesthetic, and ex-consultant Indian Air Force University Hospital, Leicester, NHS, England, and is a professor, homeopath, cosmetologist, health leader, and wellness educator, and has won. He has special experience in homeopathy and integrative medicine, obstetrics and gynecology, teaching and research, aesthetic medicine and cosmetology, preventive and lifestyle medicine, emotional wellness and karmic healing, healthcare and leadership, ICT innovation and project management. He has won so many awards and recognition. Healthcare Entrepreneur Award of the Year and Times Travel Award, National Honor of ICT Innovation, Healthcare Bharat Ratnagar Puraskar, and numerous recognitions for contribution to education, healthcare, entrepreneurship, and integrative healing. Professor Mittal is an inspiring academician and a much sought after speaker known for blending clinical science, modern aesthetic, and holistic wellness. He has delivered lectures, workshops, and training sessions on homeopathy and sustainable healthcare, advances in aesthetic cosmetology, emotional and karmic healing, hospital administration, and healthcare innovations. And today, Doctor is talking about Doctor is about to talk on from mind to body, emotional conflicts and their homeopathic resolution. Has already taken some excellent session before also. So we proudly welcome the guest of the day, Dr. Professor Amit Mittal, to this session. Welcome, sir.
Sir, Dr. Dinesh, thank you very much for such kind words. And thank you to IFPH for inviting me again to share my experience. Can you please make me co-host so I can share my
Yes,
screen?
yes, yes,
Sure.
yes, yes, you can share now.
Hope I'm visible now.
Yes, everything fine, everything fine. We can see everything, beautiful.
So kind of. Thank you, Dr. Dinesh. Thank you very much. I'm much obliged that you called me again and I'll be able to share my experience. The last time I talked about karmic healing and homeopathy, that was something which has been inspired from Kent lectures, which makes us discriminate between a human and other living creature. But during the course of my practice of last 26 years, I just want to quote one thing that nothing can evolve in air, nothing and nobody can come up in air. So there is some seedling which has been required. And that seedling makes us understand that yes, there is some problem, right? So, what today's session of mine says is that emotional conflicts and their homeopathic resolution. As you started your lecture today with a small prayer, I would request everybody to Just close the eyes and narrate this small mantra which comes up from our Indian mythology or from Sam Ved, and that is Om Sarve Bhavantu Sukhina, means everybody should remain happy. Sarve Santu Niramaha, everyone should remain healthy. Sarve Bhadrani Pashyantu, that you should be able to see only the good conditioning and the good environmental conditions. Ma Kachit Dukh Bhag Bhavet, means nobody should be able to see the bad scenarios of life, and that says to Om Shanti, Shanti, Shanti. So this is a small phrase which comes from Henneman, that the emotional and mental state of the patient often determines the selection of remedy. We as Dr. Dhanesh, thank you. Many of us are practicing in different scenarios of homeopathy. This only we as a homeopathy doctor have the power. Either we are doing a keynote prescribing or therapeutical prescribing, or we are going into depth of the patient's mind, body, and soul, everything, and doing classical homeopathy. So that classical feature of homeopathy, which has been defined by Dr. Henneman as the emotional and mental state of the patient, often determines the selection of remedy. So until and unless we deep down the system of a patient, not only the we used to talk about symptoms, what kind of symptoms we have. So we talk it physical general, physical particular, mental general, and mental particular. So when we have all those three things along with the desires aversion, then only we are able to find out the indicated remedy. Just हम लोग a classical homeopathy बोलते हैं. So keeping all these concepts in mind, and what I found in my past experience of practice, I'll be trying to share you in just a small few time of 55 minutes, which is definitely a very small time to narrate about homeopathy and emotions. So friends, you might have remembering the modus operandi of homeopathy. So from that particular modus operandi, I try to prepare this particular slide, that the command sender within the whole body, not body, but the whole soul, the whole life, meant to say, comprises of four things. Number one, the mind, that is the command center, which is directing all the thoughts and emotions. The body, that is expressing field, manifesting the physical symptoms and the health. So whatever my mind says, it has been given by our body. Right. The disease, that is the imbalance of vital force, which is disrupting the harmony within. So you might have heard about a small phrase that if there are 4 or 5 musicians who are playing different types band, one is playing guitar, other is playing drums, other is playing santoor. They are playing their own music. So that overall music which is coming to our ears when they are playing a different scenario of music will be a noise to our ears, noise to our mind. This is what a disease is. But when they all are playing in harmony, same sur, it becomes music which is pleasant to hear. So that is what disease is. And all these three things are being incorporated with each other with the help of communication. So the body speaks when the mind is repeatedly disturbed. But multiple times when we have some hit on our mind, right? I'll just give an example. We know about hypertension, the high blood pressure. So there are two types of BP. One is called as essential hypertension, other is a non-essential hypertension. Right. So what essential hypertension is? Is something bad, something hitting our mind regularly, that comes to a essential hypertension. But when we talk of non-essential hypertension, that is a manifestation of something else going inside the body, maybe a disruption in kidney or liver or anything problem, which is creating a BP. So, पहला जो बात थी, the first thing which is calling essential hypertension, there is a disruption or repeatedly disturbed of mind that makes it. So that is called as communication, the communication between mind, body, and the vital force. So what I found, whenever we talk of our emotional conflicts, see what we say, every time we are not happy, every time we are not sad. Okay, I just to quote a small phrase of our again Samved, because I think the oldest treatment or all the spathy of treatment is Ayurveda, and that to come from Samved Yigved. So there is a shlok which says Ojas Seojoho Mahi Dehi. And in that it quotes that Oj means my soul, Seojo means the supreme power from which our soul has been created. And Seojoho means whatever is been performed by us in this human body is not what my soul is doing. It's what my mind or my thought process is doing. So that many a times make my soul happy. That makes many a times my soul unhappy. So when the conflicts create hote, that conflict which has been created in my mind, that leads to physical disease. So I try to compile in 5 different points. Number 1, emotional shock. The name is clear. A sudden emotional impact can disrupt the body's vital force and overall health. Suddenly, we heard about a bad news. The people collapsed. And if we didn't collapse, we ignore that bad news, the happy news, it leads to suppression, ignoring or bottling up the emotion, and it leads to unresolved feelings. And these unresolved feelings, continuous feelings, they causes the physical symptoms. Right. So I'm having a problem with some person in a neighbor and unable to express my feeling. So they are constantly suppressing me. Whenever I look him, I start getting angry. I start getting irritated. And in due course of time, it can lead to my kidney disruption. It can lead to my high BP. It can raise my sugar as well. It can raise multiple things. And this suppression and bottling up of symptoms lead to chronic mental state. So persistent emotional states can create ongoing stress that negatively affects the bodily function. And when continuous chronic mental state is there, it leads to functional disturbances. Right. So emotional turmoil may cause dysfunction in bodily symptom, leading to various health issues. I quoted the last example of hypertension. And this hypertension, further, when there is a constant high BP, and that high BP is flowing the blood and artery with a very high pressure, that can lead to further infarct, paralysis. So over time, unresolved emotional conflicts can result in permanent physical changes and disease. So my dear friends, always remember, in homeopathy, we are not treating a disease only. We are treating a person as a whole. That's why we say it's to be a holistic care. And myself, as Dr. Dhanesh says, I'm working from 26 years, working for homeopathy, working for cosmetology. I'm teaching cosmetology. I'm teaching practice of medicine. One thing I clearly got from my experience, if I be able to club all the problematic statements of a person, then only we are able to get the cure. Might be a possibility that he's facing some problem in his job profile. That is leading to the problem. Further, in some slide, definitely I'll be trying to show you some examples of the disease which came to me, a patient with psoriasis. Further slide will come and I'll explain you what I did and what I get from the patient, what were the results. So friends, just try to deep down into your patients in past, which I found, this is not something which I always found, but these are been found in more than 90% cases. The emotional conflicts and physical manifestation. Whenever there is a prolonged grief, it leads to asthma. Grief manifests physical, often leading to respiratory issues like asthma or cardiac problems, as emotional distress takes a toll on the body's vital function. वो you might have heard ना adrenaline rush हुआ, severe grief से, we start gaping for the air, right? That leads to heart attack, sudden shock, sudden grief. So it has been found in multiple patients, in many patients. I'm saying 90% data from my side, that if there is a prolonged grief, long-lasting grief, that leads to cardiac problem or a respiratory problem. But there is a high level of fear and insecurity. These disrupt endocrine functions, resulting in thyroid disorders, skin problems, demonstrating how unresolved emotions can profoundly affect physiological well-being. So, दोस्तों, when we are trying to analyze any patient on terms of emotional conflicts or in terms of any emotional parameters, always try what is there in the life history of that patient, in the past history of that patient. In many ladies, we found there is suppressed anger. what they want to do, they are unable to do in the life. Parents get them married, they are professional, left the job, multiple things. So that suppressed anger that create internal tension. Further, gastric problem, hypertension, emotional state, and physical effort. ये सारी चीजें get in the suppressed anger. So try to find out within a patient the chronic history of the emotional conflict. बहुत ज्यादा खुशी, much more happiness. The conclusion that the body never fall ill suddenly. It cries slowly and silently through the symptoms when emotions are ignored. My dear friends, if you go to the repertory section, the mind section, there are say 100 to 120 pages. But having said that, if you go to synthetic repertory, they have a complete book on mentals. So the studies have been done immensely in the field of mentals. And if you prescribe on that mental symptom, mental, not general, if I talk of mental particulars, the results are definitely needed. Going further, this is a further explanation of the same slide. Grief or loss, it manifests the chest tightness. You might see, suddenly in particular kids, when they are being scolded highly, they start breathing, stertorous breathing, discomfort in breathing. What is that? That's the grief, the loss. The grief manifests as chest tightness, lung issues very quickly. So that might be a hysteria, but not every time. But not every time. There is a fear and anxiety, it leads to heart problem and thyroid function. See, whatever I'm writing here is nothing which I got from any book or got from Google or Chat GPT. I have a habit to compile my cases and try to find out their age group, their gender, their disease condition, their physical condition, and their emotional condition. And then compile the whole data, and then I'll be able to create this picture. Suppressed anger, as I told in the past slide as well, the suppressed anger is frequently linked to liver dysfunction. Gastritis, severe gastritis will be there. Guilt, self-blame. So guilt can lead to skin conditions, affecting dermatological conditions and health conditions, self-image. Insecurity. The insecurity leads to endocrine problem, thyroid, right? Reproductive health issues, right? Insecurity leads to impotency in many cases. If we are able to plug that insecurity, the problems are resolved automatically. So I'm saying that these patterns are the tendencies, and we should not consider as a rigid rule for diagnosis. So I got these 6 points by compiling my patients. You might be practicing from 3 years, 5 years, 7 years, or 25 years, or even more than me. Guys, start compiling your data. Not only in terms of their problematic areas and their medicine, but that will help you to understand where you are getting the failure. Right. So I say we are not God, we cannot get 100% result. But the data says if you are getting 70% results, you are doing very, very good. But that 70% should be an authentic number. So try to find out the failure, and then you will be able to understand in other cases what you have done and what you have not done in this case. Start getting the results. So I try to compile, then I'll be able to find out my mistakes, and further these patterns help me to get a small kind of a tendency which helps me to reach with my medicine and get the results. So as a physician, we are doctors. There might be a Ayurvedic doctor, allopathic doctor, Unani doctor, a naturopath, a physiotherapist. But I think we as a homeopath, we talk of holistic care, which is much, much beyond the symptoms. So what we mean by holistic, we all might be knowing, but what I found, what I understand, that is understanding a person as a whole. Whole doesn't only means the physical symptoms or the mental symptoms, but the environment in which the patient is living, his family conditions, his professional conditions, his friends' condition. So healing requires on different emotional layers. Right. So what we say that life is made up of life is. I just to give an example that life is like a string. The one end is known to be as a personal, means me myself. and other is known as my profession. So I'm having two phases, my personal life and my professional life. This is personal life, this is professional life, and everything comes in between. So if there is a proper harmony, the thread will remain straight. And if anything is lacking, it will either disrupt or it will be stretched so much that it will break. Right? So we as a homeopath should have the capacity, should have the understanding to understand each and every aspect of the patient. So जब भी whenever we are talking to the patient, सबसे पहले always keep in mind that apart from keen observer, we should be silent listener as well. Never interrupt the patient in between. We should be an active listener, because whenever we are listening beyond words and symptoms, we are able to get there. Right? Say a couple is sitting in front of us. Okay. Suddenly you find that the lady talking about her symptom, she started pressing her hands. Right? Because there it comes up that she is in space of some anxiety which she wants to share but is unable to share in front of her husband. And vice versa as well. कहीं ना कहीं might be a possibility there is some fear or insecurity that if I narrate the symptom, my spouse will get angry. There we have to hit. Either talk them in person. So, and that can only come when we build trust in our patient. Trust cannot come in one day. It might take 2 days, 3 days, but that bonding which a patient and a doctor is having, that is to be so strong that automatically trust comes. And guys, I think the case taking procedure is only and only intense and deep only in homeopathy, neither in allopathy, neither in Ayurveda. Yes, I understand they work on shlokas, they work on past history, they work on karmas, but only homeopaths have the knowledge of holisticity, the holistic care. So I talk of life event, understanding the transpired prior to the illness can reveal critical insight into the patient's emotional state and overall well-being. Friends, if we are taking a case taking and a patient is narrating 3, 4, 5, 7 or 10 symptoms, we always talk since when you are suffering from this problem, since when you are suffering from this backache, this headache, or when are you suffering from this hyperacidity. But having said that, there's one question which is always there. I don't know how many people are asking or not, but I always ask one thing. Tell me the point when you are perfectly fine. Tell me the point when you are healthy. Or then the patient is able to say, you see, when I completed my graduation, I was into my master's, and in second year, I start getting this problem of acidity. Then post that, I start getting headache. Bhai, in that second year, what happened when you start suffering from this acidity? So that is called an RCA. RCA is root cause analysis. So when we try to get the roots of the disease, definitely the solution will be there. So understanding the emotions, identifying feelings that were never conveyed can help uncover significant emotion barriers that contribute to the patient's condition. I told you about that rubbing the hand or making the fist, or you can see that the emotion which has been expressed by his or her gestures. When narrating some particular symptom, he or she may not look into your eyes. The confidence level is down. So, if you are a keen observer, we are not interrupting a patient. We are trying to getting the deep dive into the system of the patient and silently, actively listening. Then only we'll be able to understand the unexpressed emotion, and that will help us to find out the problematic areas in that patient. Habit of conflicts, to identifying feelings that were never conveyed. So, guys, you might be understanding that I have repeated the points in different ways: life event, unexpressed, habit of conflict. So emotional barriers contribute to the personal conditions. Wahan that husband or wife is unable to tell something which he or she found that if I speak this in front of doctor, that can ruin my family life. Right? It can be an emotional trauma, it can be a physical trauma, it can be a social trauma, it can be a professional trauma. But the patient is not narrating. So we have to understand and try to read in between the lines. Don't read extra, but try to understand the things. Just to a small case of migraine, I think this will help to understand what I'm trying to say. So this is, I think, the year 2016 or 15. It's a female of 43 years. She came to me with a migraine from last 18 years. History of chronic migraine, exploring the emotional factors contributing to a condition and the corresponding home remedy. So physical symptom, as we all know, left-sided pain was there. The pain always worsened before the menses. It is better with the pressure. She was having a nauseating tendency, continuation during the pain. She was unable to see the bright lights. There was a throbbing, pulsating pain in the temporal region. The occiput was bursting like anything. Blah, 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 multiple things. On that base, she had been to some doctor of homeopathy and some allopathic doctors. They are giving Sabelium 10 milligram. Other doctors are giving her that belladonna and glonine, lactaninum, lacdafloritum. She was not getting a relief, but temporarily she got the relief. But after a lap of time, again the problem comes up. So when I started talking to her and deep down in the system, I found that long-standing suppressed anger was there. Over-responsible nature was there. Unable to express dissatisfaction in the marriage was there. कैसे पता लगा? How I get these? So when I was talking to her, I found that the lady had done her master's in economics. She was in B.Ed and M.Ed, and before marriage, she was teaching in a private school and teaching the senior students of class 11, 12th economics. Married to a good family, definitely a good family. She left the job. And after the job leaving and coming to the married life, she was such much involved in maintaining the family, but that involvement with the family and the past before marriage teaching profession, they start colliding each other. And she was so responsible, which was before also, but now the responsibilities are much more. Her sister-in-law was there, the younger sister-in-law, the wife, the sister of the husband, the parents, everybody. And she always tried to please everybody. And never expressive. Whatever has been come to her kitty, she performed well. Whatever is coming to her plate, she did good. Waking up early in the morning, 5, and going to bed at 11:30, 12:30, 12. No complaint. So when discussion comes up, and I reportage the case, the medicine comes natramuratic. So this was basically on her mental symptom, and I prescribed natramuraticum in higher dose of 1 ml. I prescribed a 3 dose, and NICL was given to her. And guys, just in a lap of 3 weeks, I remember. Number one, she got emotionally better. Right. The migraine frequency was reduced, which was almost alternate days after 1 m of Netramur 1 m. The pain didn't came even for 7 days. It came again and again it goes off. So in complete 1 month, only 2 episodes were there, because before almost 10 to 15 episodes. Improved emotional expression. Now, how do we get these points of results? Very simple. The words which she came to me, which she came to me was, first of all, I narrated in Hindi then English. डॉक्टर साहब दर्द तो है, पर मुझे काफी हल्का फील हो रहा है. Means she said that I'm having pain, but feeling very lighter. That pain is not troubling me. Despite of the pain, I'll be able to perform at my family. Despite the pain, I'll be able to do all my households. So, boss, this is what I get. So, clearly, the learning comes from this was, when suppressed emotions are released, physical sufferings are reduced. Those physical sufferings is not 1 or 2 days of development. It might have taken months to develop those sufferings. So try to get that emotional sufferings try to get that suppressed emotions, release them, and the patient will be cured. Definitely, I'm not releasing. Natrum has released it. Right. So until unless I deep down into all the symptoms, I was unable to get that medicine. One more case. This is a case of psoriasis. Sorry, I'm unable to share the picture because the patient didn't allow me to share the picture. Why didn't share the picture of his? So he's a male of 47 years. Psoriasis was there from last 17 years. The history of chronic skin ailments. He was diagnosed by allopathic dermat with a psoriasis. Discussion mein, I got that a workplace humiliation was there, unresolved emotional conflicts were there, highlighting the profound modifying connections, factors contributing condition. Physical symptom, as we all know, they were classical red, raised, patchy skin, silvery white crust, or the scales were coming from the patches. The skin was dry, cracked, bleeds, and while itching, it bleeds. The burning was there, soreness was there. The skin was thickened as well. During discussion, I found there was a humiliation at work. He was a team lead, but his boss never appreciate him. The only word, सोचते नहीं होगा. He'll not be able to do it. Why? So he have got a strong sense that injustice has been done by the people in his life. First injustice I got after completing his BTech in CS. He got the opportunity to go to abroad for his job, but the parent didn't allow. So he took the job in India. So he thought there was injustice done to me. Then in job which he should get in 4 years or 5 years of job, he didn't get, but his colleagues got it. Again, he find that some justice was there. Now he's doing his best, but never get appreciated. So, Bruin was always there over insults, multiple insults were been done to them. He used to do all the work with the teammates, but the credit was being given to anybody else. He was much reserved. He never expressed his feelings. He was definitely having a revengeful thoughts internally, but no outward expression. Everything was going inside his mind. I'll do that, I'll do that, I'll kill him, I'll do that. Multiple things, but he never expressed. So when the case was reportized, the medicine comes Staphysageria. After giving Staphysageria, in just 2 weeks of time, he started feeling emotionally lighter. After 2 weeks, he came, he said, Doctor, day before yesterday in my team meeting, when my boss was briefing me and he said something to me, I answered him abruptly. That, no, you are wrong. Just see the work, this has been done by me. Before that, he was unable to do that. So that releases his emotional stress. He burst out in a very humble way, in a normal way, and that makes the emotional conflict release, and over a period of time, there is a gradual clearing of the skin. The things come up, as I told before, the suppressed anger, the suppressed all those things. Skin reflects suppressed emotions and self-image conflict. My emotions suppressed, my image conflict is there, so that comes on my own physical images. So why suppression method? I'm talking all about suppression. I'm talking of emotional stress. I'm talking of emotional burst. The modern society says, be strong, don't cry, move in. But suppressing emotions can lead to deeper health issues. Never forget. Often manifesting unresolved feelings into chronic ailments that result from acute issues, homeopathy offers a path for safe emotional expression and rebalancing. So guys, if we are having any chronic ailments, nature never forgets the thing. There is an old saying that if there is a heavy rainfall, and water flows in a kind of a small river to some place, it got dried up. In 100 years of time, it will follow the same path. Means nature never forgets. Right? In jungle, the animals do not have a GPS system. They do not have any kind of a roadways, don't have any road marking. But still, they goes into the jungle, in the dense jungle, and are able to come back. Because they are the part of nature. They understand the things as the nature from direction of sun, moon, or the stars. And this is what happens in our life as well. So which I found was that a simple thing. When our disease emotions are suppressed, the disease moves deeper. We're unable to express from mind to functional disturbance and finally to the structural level, from acute to chronic and finally incurable stages. So in every of my patient coming for a chronic ailment, before the stage goes to incurable stages, try to plug the problem, try to plug the emotional conflict, try to plug each and every aspect of his life, then prescribe and make that incurable stage to chronic to acute to functional in correction to mind correction and finally the health condition. Right, guys? So what we as a homeopath do, everybody knows, but these this particular slide, I used to go to many of the clubs in my city, in my cosmetology clinics, in my public awareness campaigns. So I try to aware the people what homeopathy did. So that's why these some slides. So this is just a revision for we all. Homeopathy promotes holistic healing through emotional balance, mental clarity, physical recovery, emphasizing the interconnectedness of mind, body, and healing the injury. Hamara modus operandi, that mind, body, and soul, or the vital force, they are working in harmony. There is a stage of health. Anyone is deteriorated, condition is of disease. So, what our package is, again, I repeat, it's a holistic healing through emotional balance, mental clarity, physical recovery, emphasizing the interconnectedness of mind and body. Thereby, emotional balance restores inner peace, stability, mental clarity, enhanced perception, decision making ability, and physical recovery promotes overall health and well being. I think these 3 points are very clear. If I'm mostly balanced, my inner peace and stability is there. I'm coming from work to home, home to work, everything is fine. Emotionally, I'm sound, having a good relations with my wife, my kids, good relations with my patients. Emotionally, there is a stage of peace and stability. If I have a mental clarity, I'm very much clear that my perception will be clear and I will to take the decision very fast. Physical recovery, it makes me healthy. So homeopathy offers a path for safe emotional expression and rebalancing. So as I said, doctor, I feel lighter. I feel more peaceful. कुछ तो हुआ है. Something has changed. So this is the clarity when vital force is correcting itself. You all know our medicine works on vital force. So when vital force is correcting, when vital force is re-energizing, when vital force is in a term of spiritual correction, that leads to health. This is what we as a homeopath do. The global emotional climate, understanding the current emotional climate in today's world, fear, current uncertainty, isolation, insecurity are the prevalent emotions. आजकल की Gen Z, they have to on a solo trips. अकेले घूमना है. Solo trip, insecurity, isolation. So these feelings make them cut from the family, from friends, and everything. And finally, they impact individual, influencing both mental and physical outcomes. So what factors are impacting the The fear impact mental stability. Right. The uncertainty creates the physical stress. The isolation affect the emotional health, and insecurity leads to anxiety disorder. And these anxiety disorders are rising. Autoimmune disease affect many, and hormonal imbalance is common. Simultaneously, psychosomatic illness are increasing. So we are at our clinic. If you just try to analyze, especially the people who are working since long, like me, from 25, 26 years, that in last 10 or 15 years, there is a drastic change in the problems which a patient is narrating to me. They're more of physical, they're less of physical, more of emotional. And before we have more physical, less of emotional. So all those anxiety which has been creating because of the fear, uncertainty, isolation, peer pressure, sibling pressure, parental pressure, social pressure, financial pressure, all those uncertainty are making them isolated to work more and more or moving alone. Sorry. So what we go for a personalized healing approach. As I started my slides today or the talk with you guys that we are talking of holistic care. We offer it never happens that in every case of coryza we are providing alien seeds or we are providing arsenic. From person to person it differs. A small change of symptom we are able to tweak the medicine and we get the result. So we offer a personalized healing experience addressing individual needs, promoting overall wellness through natural remedies. And what are the key benefits for us? Our pathy is gentle, as we all know, non-invasive, cost-effective, definitely, but I'll not say I'm a high-charging doctor in my city, Ghaziabad, but definitely we talk of individual patient needs, holistic approach. So moving forward, recognizing emotional factors in health is crucial for effective treatment and promoting holistic well-being for the individuals. Guys, इस बात पे प्रॉपर ध्यान रखें तो we'll be able to understand. Again, in compiling my things, never rush to the prescriptions. Observe, listen, understand, then only try to prescribe. One emotional sentence may outweigh 10 physical symptoms. A well-chosen remedy heals mind, body, and spirit, or what we call vital force. So disease begins in mind, but healing begins in awareness. Homeopathy restores harmony by addressing emotional conflicts, mental patterns, and physical expressions. When mind heals, the body definitely follows it. What we say is, until and unless we are my pain to come, the pain cannot touch me. It's all about my mental perception. If I had a feeling that that person is going to harm me, despite he is not harming, if he puts the hands in the pocket, we'll start thinking he's going to shoot me. Because we have created the perception. So, heal your mind by correcting the vital force, the body itself follows it. So, let us practice homeopathy not only as a science but a healing art. This is what I am doing since last almost 15 years, will not say from last 25 years. Reason being, in the initial stages, we also do like a newcomer, new budding doctors, practicing therapeutically, practicing in a different scenarios. But over the period of time, we start understanding that homeopathy is much, much more than that. And from last about 5, 7 years, I just founded this institute of Glamrets Institute of Cosmetology and Aesthetics because we, as a doctor of homeopathy, understand that in dermat conditions, in dermat problems, the maximum best results are being achieved either by homeopath or by Ayurveda. So we are treating a patient internally, we are curing a patient internally, and by cosmetology and aesthetics, we are treating the patient externally. This is all about from my side. Dr. Dhanesh, over to you. Any questions from anybody? Please let me know. Dr. Dhanesh, are you there?
Yes, sir, it's really an excellent session, as you rightly point out the importance of studying mind and not only simply studying the mind, but the person himself and how it can be cured. That's the biggest question in front of us, and we need to look into each and every part of the person, not the physical alone. But the thing is,
Exactly.
most people looks at the physical symptom that the patient is expressing. Doctor, I have migraine for the so many years, 20 last 23 years, I am suffering from this now. Then if you simply ask when it all started, oh doctor, I may not be remembering, but then she may say, oh doctor, once after the death of my child, I
Ah,
starting these things, and I have seen, I took even MRI to find out what is the reason but the doctors say that there is nothing wrong with your brain or anything, but still and one of the doctors advised me to go to the psychiatrist to take the medicine, but actually it is no. But if the patient is here with us, we can definitely manage with even simple consultation. Consultation won't give any relief, but homeopathic medicine are the super counselors, and they will do the exact thing which requires. And at times, you can ask the patient, and once she or he gets relief, then you can advise, you can see, you do a little bit of yoga, or you do a little bit of exercise, proper diet. You need to interact with your friends, and even if we can advise them, or you can go for big tours with your family and try to start enjoying. But this is the biggest challenge in front of us. Most of the people try to treat the patient and treat the disease and not the disease.
Not the patient.
Yes, that's what you were mentioning, and you know you are using almost every part of the health profile to get the patient back to health. In the short. That's the reason why even after studying homeopathy, you were running for some studies, and you try to acquire knowledge about that from different field of particularly the cosmetology, as we all know that lot of people, the new generation people are running for this thing. Then, if we know all these things, we can give some good advice, as well as we can give some good techniques to improve their health condition.
Skills. Right.
Anyway, congratulations, sir. It's the time for discussion, and those who want to participate in discussion may please raise your hand so that we can have a little bit of chat with Dr. Amit Mittal. Yes, Ram, this is Harish ready. Yes, please unmute, sir.
Thank you, Dr. Thaleji, everyone. Namaskar and congratulations, Dr. Amit Mittal, sir. Very nice, excellent presentation.
Thank you, sir. Thank you.
Mind, body, emotional conflict. Main cause of disease, mind, according to homeopathic science. And Dr. Handman emphasized that disease originates in the dynamic plane. Disease originates in a dynamic plane, mind and vital force before appearing in the physical body. शरीर से पहले माइंड में ही बीमारी होता है. कॉज इनविजिबल एंड रिजल्ट विजिबल. तो माइंड इज द मेन कॉज. इमोशनल, ग्रीफ, इंसल्टिंग, मोह. रामचरितमानस में कहा गया है, सुनो तात मानस रोगा, जिनते दुख पावन सब होगा. काम बात कफलोभ अपारा, क्रोध पीत निच्छाति जारा. तो माइंड इज द इम्पोर्टेंट. एंड होम्योपैथिक साइंस, homeopathic is the not science. Homeopathic is the science and art. And homeopathic is the gently science. Homeopathic gently, rapidly, and permanently. Permanently means curative way of treatment, not palliative way of treatment. So cause, mind, and result, body. So very good describe the mind and body, emotional, anger, grief, insulting. There are two case, migraine, and one case is a so very good. Astisgeria is the very good selective remedy. Insulting after, and anger after suppression, psoriasis. So very nice presentation. Thank you, Mittal sir. Very thank you.
Thank you, sir. Thank you.
Now I'm inviting Ms. Binoy to say if you have a conversation. Binoy, please unmute.
Yes. Yes, doctor. I partially joined the call, but you rightly mentioned one thing. When we treat with our homeopathic medicine, the right medicines. It starts in the mind or in that plane, and you spiritually get a feeling that you are the feelings are you are feel lighter, and you feel that betterment from your mind. That's absolutely true. That's where the healing starts. That's from where the healing starts, and your body will follow, and you'll get to the absolute the right mindset and right body set. Thank you very much for that explanation, and it's a well thought out presentation. Thank you very much, Doctor.
Thank you, Vinay, sir. Thank you, Vinay.
Yes, Dr. Sheila, you can speak for a minute.
Good evening, sir. Amit, sir. Very good evening, and
Good evening.
thank you for the good session, sir.
Welcome, welcome.
You explained very well how we can practice the classical homeopathy, including the mental sphere, considering the especially the mental sphere is very important for every case, especially the chronic cases also. Because even though we are giving superficially for the reducing the physical symptoms, if the mental we are not considering the mental sphere, the disease will happen. Then for restoration of a complete cure, we should give more importance to the mental symptoms. Our master also giving more importance because they are. He's also telling first is affecting the mind only, then the physical symptoms will appear actually. So as you said, we are giving more importance to the mental sphere. Then only the second one only the physical symptoms. So I think better, sir. Thank you so much because it is really a good session for especially the newcomers also, because those who are going to practice because from their experiences they are getting more and more experiences by giving more importance to the mental symptoms. If we are giving more importance to mental symptoms, actually we will get the complete cure actually.
Right.
So this will cover all the constitution also, I think so, sir. So thank you so much, and well done, sir. Thank you. Thank you. Bye.
Yes, thank you, Dr. Sheila, and is Dr. Amit. Yes, I would like to ask one question. How will you interfere with the cosmetology in treating a patient, and at what time of it? I actually, yes, no problem. Take your own time. Lot of people used to come with some acne or some other problem with
Yeah. So your question is how I integrate between cosmetology and homeopathy, right? So just only today itself, there is a case. The patient was having a severe acne. And let me show you the face of the patient. So he was having the scars of the acne. You just see the screen of the mobile, right? You can see the nose,
can see.
right? And see the right side
Yes, yes. Lot of marks are there.
and the left side,
Okay.
right? So he is a boy of 27. This is a today's case only. He is a boy of 27. In the younghood, when he used to get the acne, he used to burst them by piercing with the nails, and that causes the acne scars, right? But still, he's having the active acne. When I start discussing with him, almost on the verge of marriage in next 1 year, a discussion going on. So by homeopathy, I'll be able to understand how to recover those acnes. Internal treatment, but the scars cannot go with the pathy, right? All those ditches which have been formed in the space, they cannot go by homeopathy. For that, I always prefer for cosmetology, and I'll do a simple treatment of microneedling, radio frequency, MRF, microneedling and radio frequency, and I think 7 to 8 cities, almost 80 to 90% scar will go away. Simultaneously, I'm getting a case of melasma, right, or a hyperpigmentation, right? So hyperpigmentation, melasma, definitely only we have the treatment, but long lasting. So however, if I have two treatments simultaneously, one homeopathy, which is spreading internally, and those out skins, the outermost layer of the epidermal skin, if I will be able to burst with the laser, the results are very fast. So this is how I'm trying to integrate between homeopathy and cosmetology, and I'm opened the institute particularly for my doctors of homeopathy. So I'm going to Dr. B.R. Sood to take the lectures, Daxon Medical College, Noble University, Gujarat, Solan Medical College, Solan. So this is just to aware that we as a homeopath have a power to cure a patient from inside. And if we have an integration of cosmetology, then definitely both will do wonders.
Yes, thank you, sir. It's a very, very good session. And I'm inviting Rambaresa sir to say what are thanks to the session.
Thank you.
Thank you, sir.
Dr. Amit Mittal, sir. Very nice, excellent session.
धन्यवाद.
Behalf of IFPH whole team.
धन्यवाद sir. धन्यवाद.
Very
बहुत बहुत
thanks. Again, presentation. Very, very thanks. Thank you.
Thanks. Jai Hind sir. Thank you.
You are Ghaziabad practice.
जी सर, गाजियाबाद.
अच्छा अच्छा, गाजियाबाद is my देव सिटी.
वाह.
मेरा फ्लैट है देव सिटी में.
बेचना है या खरीदना है सर?
नहीं लिए हुए वहां पर बेटा लिए.
Thank you, Dr. Rambaresa sir,
Sir.
Dr. Sheila, Dr. Amit Mittal, and those who attend the session. We hope that you will come up with some more presentation in the future.
Sure, sir. Thank you, everybody. Thank you, Dr. Dinesh. Thank you, IFPH.
Tomorrow we will have a session from Dr. Sandeep Sairal, and Doctor will be talking about gallbladder, the victim. Thank you all. Good night. Over to Dr. Shaila to moderate the Malayalam session.